I had a patient the other day, I think she paid me one of the nicest compliments I think I've ever received since starting this. And she's been our patient for a little while and has just started going down this path of aesthetic rejuvenation. And her husband was very reticent for her to have any of these kinds of things done, because I think he had a preconceived notion that if his wife received toxins or fillers, that she would no longer look like his wife. And she said to me the other day, she said, "You know when it changed for him?" And I said, "No, when?" She said, "When he met you." And I said, "Why? Because I didn't look crazy?" And she said, "Yes." So he knows, that I'm a woman of 58 and I have had Botox and fillers, but I don't look not myself. And so that was really awesome and very sweet and humbling for this sweet husband to be like, "Yep, go do what you want to do," because he felt that he could trust this process and that his wife would continue to look like herself. Hey everyone, I'm Lucy Douglas. I'm a family nurse practitioner and I'm owner and CEO of New Beginnings Wellness Center and Spa here in Ruston, Louisiana. So this is a continuation of aesthetics here at New Beginnings. And so it's a passion. It's something that I just absolutely love doing. I've invested a lot of time and energy and financial resources in my training over the last 8 years. So we've been talking about the various products, some information about those, how they're used, some of the areas that I'm injecting. And I think I wanted to talk a little bit in this video about some of the common things that are being requested by patients that are coming. I know lips is probably, if I went back and searched through my electronic charting, that's probably going to be the number one. And I don't know why that is necessarily. Maybe because this is, there's colleges so close together here up and down our I-20 corridor. So all of the injectors in our area are drawing, a lot of young women into our practices. And so I think that's super popular. It's very cost friendly. So most people can afford one syringe of filler to enhance their lips. And it's really fun to do that. I really love the instant gratification of it. I love to see women's faces when I hand them the mirror and they smile and they're so pleased, and that's really fun. But what I feel like I bring to the table as an injector is it's my holistic approach that I use with my medical clients. So someone might come in and talk to me about wanting lip filler, and I'm certainly going to, do that for them. But also I'm going to look at them, assess their face, talk about skincare, talk about sun protection. I've even, as I'm maybe up close on someone, maybe injecting their toxin, I've even had aesthetic clients convert to medical clients because we start talking about, maybe I notice thinning eyebrows and I can't help myself. And I'll say, "Do you perhaps have hypothyroidism?" And sometimes they'll look at me like, "Who told you that?" And like, "Well, I noticed your brows were thinning. Is that new? Has that been ongoing?" So that starts a conversation that takes us down a whole different pathway. But some of the areas besides lips that I really enjoy, I just love full, we call it pan facial, full facial rejuvenation. I feel like when we look at each other and we assess each other, what we're looking at and what we're identifying as beautiful or handsome in the other person is actually math. You didn't know that, but when you are looking at a female, you're seeing, if you say to yourself, "Oh my gosh, she is so beautiful," or if you look at Liam Hemsworth and you say, "Oh my gosh, he is so beautiful," what you're seeing is math. So in women, if you divide the face, it's equal thirds. That's the right or proper or ratio that's considered beautiful, and your eye is evaluating and your brain is receiving that message. In men, it's a little different. So it's if we're dividing into equal thirds, it's a third, 0.8, and 1.2. So what makes a man handsome or masculine? It's a more dominant lower third of the face with that strong masseter, strong jaw, and strong chin. So those are things that I'm looking at and evaluating the face of either my male or my female client. And so I will give feedback to them, even if they're saying, I think I need cheek enhancement, or I think I want lips. And I'm like, well, that's great. And let's definitely do that. But let's consider this down the road, because I feel like, aging is happening. Even in the 20s, we're starting to lose collagen. So, bone resorption can start being a thing later 40s into the 50s. I mean, sun, breaking down collagen, poor diet, smoking, all of these things are wreaking havoc on the skin. So if you put into place, say a woman in her 20s comes to me for lip enhancement, but if I can speak into her life in that moment and say, well, hey, let's also get you on a great skincare regimen, or I begin to teach her about that and, evaluating her side profile. And I feel like while we're doing the lip, I feel like we need to strengthen that chin so we don't have a recessed chin with now this beautiful, voluptuous lip that's protruding further out than the angle of the chin. So these are not things that women can easily see in themselves. So when someone comes to me and they place their trust in me, that's the kind of evaluation that I'm going to give. And I had a patient the other day, I think she paid me one of the nicest compliments I think I've ever received since starting this. And she's been our patient for a little while and has just started going down this path of aesthetic rejuvenation. And her husband was very reticent for her to have any of these kinds of things done, because I think he had a preconceived notion that if his wife received toxins or fillers, that she would no longer look like his wife. And she said to me the other day, she said, when it changed for him? And I said, no, when? She said, when he met you. And I said, why? Because I didn't look crazy? And she said, yes. So he knows, that I'm a woman of 58 and I have had Botox and fillers, but I don't look not myself. And so that was really awesome and very sweet and humbling for this sweet husband to be like, yep, go do what you want to do, because he felt that he could trust this process and that his wife would continue to look like herself. And she's gorgeous. And so it was easy to just do a few tweaks to just make her all the more gorgeous. So when we talk about utilizing these various services, one thing people ask is it going to hurt? Well, I mean, every injector kind of has their way of approaching this process. And I have gotten very comfortable using a cannula. So let me just show you what that looks like. So it's got its cover on it. So this is a hollow tube. So this is not a needle. So this little hollow tube, I would attach to my syringe a filler, and I would use my needle. This is my needle. This is the poke that you would feel. So if I'm going to use a cannula for lip enhancement, it kind of depends on the person and what our goal for that treatment is. And sometimes it's a combination of cannula and needle. But I would make a little poke out here at the side to thread this hollow tube in and lay my filler down. So when I had my cheeks done this summer, the injector that I saw for that, adorable and fabulous, she was a needle girl, 100%. And I had 4 syringes of Radiesse put in, 4 in one sitting. I looked like I'd been beat up in a parking lot. I mean, I looked pretty rough. We did use some numbing cream, but I signed up for it. I asked her to do it and she did a great job, but I'm telling you, there were a few places that made me stuck in my breath. But, so depending on what we're doing, what your level of pain tolerance is, we can address all that before we get started. And I will make you as comfortable as I possibly can. The use of the cannula, obviously you can kind of think, well, if this is a blunt tube and this is attached to the syringe of filler, and then I make one little needle poke. So say I'm going to be working here in the mid face, and I'm going to, more often than not, I'm going to use a cannula here in the mid face because we have some very exciting anatomy that we want to avoid. So we have some arteries. We have the facial artery that comes up here and comes right up here. And so if I'm correcting mid face, I'm not going to want to accidentally cannulate that artery with a needle. So I'm going to make one needle poke and then thread my cannula in and begin my correction. The tear trough area is another area where I'm going to, more often than not, use a cannula. Sometimes I'm backfilling a little insulin syringe with some filler, and I'm doing some on-bone correction, and then we'll finish the treatment with cannula and using one of the products that I spoke about earlier. So that's a really fun area to correct. And the way I approach correcting this hollowing under the eyes, it's a multifactorial problem. Oftentimes the client might need some lateral or medial cheek correction to soften the transition. And then perhaps maybe the next treatment do a little bit of under eye treatment. But it's every one of you is different. And that's what I want you to appreciate, is that each injector kind of has their little repertoire of tools that they're comfortable with. Like the injector that I sought to do cheek correction for me, that was her comfort zone. That was what she was good at and familiar with. So I sat in her chair and I let her do her thing to me. I really like the cannula. I've gotten very comfortable with it, and I've used it for temple correction. I've used it for medial and lateral cheeks. I've used it in the jawline, in the chin, this mental crease. I've used the lip. I'm pretty much comfortable with it all over the face. So those are things we discuss when you come in. Your goals, what you feel like you're needing, what your budget is, and then I like to do things over a period of time. Even if someone said, you know what, Lucy, I've had this happens occasionally. Do whatever you think I need. All the injectors are like, yes. Sometimes we hear that, but more often than not, it's, I have X amount of dollars to work with right now. And so I'm like, well, what are your priorities? And then we kind of go from there. But I have this wonderful repertoire of products to bring to the table, and then my technique using needle and cannula to give you a great outcome and a great result. So I hope that helps you as you're sort of thinking about, are these things that maybe I would like to do? I think we should all be really open about, these are things that I'm doing, and I don't mind telling you that. I don't think that I don't look like myself. I just want to be the best version of myself and still remain true to Lucy and as natural, as I am. But I don't think that we should feel embarrassed or ashamed that we seek aesthetic treatments to feel the best we can about ourselves. And just know that we're going to discuss all that in great detail when you come in, so that you feel comfortable going forward and feel like you've been heard, and that I'm going to stay true to who you are and what your goals for treatment are. So thank you so much, and I look forward to talking to you soon.